Good afternoon, everyone. I'm deeply grateful to the UW School of Public Health and its leadership for this honor and the opportunity to speak today. Having had my graduation almost a decade ago, the memories are still fresh. I remember that the joy I got most was not of my accomplishment, but rather of the pride in the faces of my family, friends, and mentors. So dear graduates, let us give a standing ovation to your family, friends, mentors, and well-wishers who deserve the celebration just as much as you do today. Thank you. So in 2015, I could not bring my dad during my graduation because there was a massive earthquake in Nepal. But this time he's here, and my wife and son too. So from this stage, I also want to thank them for making me who I am today. Thank you. So commencement speeches are supposed to be inspirational, aren't they? So I started my draft in that manner. But then I stopped and thought, well, here at UW, it would be redundant if I started to give a sermon on how to change the world. In this institution with people who have made remarkable impact in public health, inspiration finds you every day, almost haunts you every day. Talking about inspiration, I have to tell you, back then we did not have the magnificent Hans Rosling Center that you have today. We just had basically the T-wing. Yeah, by any chance, did you hear stories about people who got lost in the T-wing and never came out? Yeah, we used to hear that often. For a person coming from Nepal with a lush green view every day, attending lectures in the somber classrooms and windowless chambers, inspiration didn't come easy. Maybe it too got lost in the complicated hallways of T-wing. But however, as the rigorous training unfolded over ensuing days, things started to make sense. Personally, the lectures that gave examples on how certain programs, studies, and some numbers, just plain numbers, transformed the world excited me the most. The stories of smallpox eradication, pioneering works on smoking and lung cancer, research on asbestosis, landmark epidemiological studies on cardiovascular diseases, works on HIV prevention and management, and many more, all led by public health professionals. So setting inspiration aside, today I have come here to make a few confessions. The first is, the real learning of public health starts mostly after graduation. After 6 years of education here, I started my journey back to Nepal with high hopes and confidence of creating new academic programs, initiating novel public health activities in rural communities, and collaborating with government in enhancing health policies. I almost had a clear-cut plan well laid out in my mind. But guess what? As I started delving deep into the nuances of the work, I began to feel it is not that straightforward. Public health is a unique field, probably one of the very few fields that touches almost every other disciplines, be it medicine, sociology, politics, economics, engineering, and so on. It is a field where one day you might be having a conversation with an illiterate poor person in a rural community, and the next day you might be arguing with a minister. One day you might be talking to a young student at your university, and the other moment you are speaking with the renowned researchers from another part of the world. As much as its vastness intimidates you, the uncertainty it holds intrigues you. As a medical student, I had never studied climate change. Once in 2012, when I was attending a presentation on climate change, I asked my friend sitting by my side very naively, is this really that big of a deal? Like, I mean, do you even notice if you turn your room temperature up by half a degree or 1 degree? She stared at me in shock. 10 years later, in 2022, dengue, a disease that was almost unheard of in Nepal, struck the nation by surprise. And I found myself struggling in addressing it. Due to the raised global temperature, the mosquitoes that transmit it are now found in newer territories. Despite having prior training in infectious diseases, I had focused my Ph.D. here in epidemiology in non-communicable diseases, believing that this was the future and this was the most pressing concern of the world. And a few years later, COVID hit. So be prepared to be surprised. And when one gets surprises all along, one has to be able to create one's own ecosystem and teams to work in that context, constantly discovering, adapting, and innovating. During COVID, whole day I would be working in the community with local leaders, and in the evening, the Zoom calls would be with the officials in the ministry. All along, our team of students, researchers, staffs worked to pull together the numbers that made sense of them for targeted planning. Hence, the ecosystem we had to create included people from all walks of life, contributing in unique ways to fulfill a common goal, to save lives and reduce suffering. I also have another confession to make. We are rarely trained on the value and strength of perseverance. In our lessons on social justice and equity, we have learned that the world is by default an unjust place. We are living at a time now when more than ever before, these things are evident. The strong oppressing the weak, the rich exploiting the poor, and the privileged turning a blind eye to the helpless. That is why the world needs people who are willing to take risks, people that stand their ground and vouch for what they believe to be right, people who can persuade and induce change, just like you all. This might start, but does not get accomplished with one demonstration, one petition, one speech, one publication, or one grant. This happens with continued effort and a more thoughtful strategic planning, which might often be filled with disappointments, discouragements, and uncertainties. This means building programs, teams, and institutions that may need to outlast you, unlike the periodic viral trends or the spurts of agitation. So be prepared to be perseverant without dampening your passion, and remain endurant without losing your fervor. Very early in Nepal, we realized that sustained achievements in public health required the next generation of public health leaders. For this, we would have to build academic institutions and programs capable of training them. However, initiating these programs seemed no different than launching startups, with all sorts of responsibilities shouldered by a few of us. Delegation takes time. Creating teams takes time. Raising funds takes time. But one has to start somewhere. Thus we started and also experienced repeated failures and setbacks. But we did not give up. We have now enrolled the 5th cohort of our master's program in public health. And finally, we are beginning to slowly see the initial signs of a stable, rigorous, and quality training and the faces of emerging leaders in public health. My last confession is that we are more often conditioned to focus on the magnitude of the challenges we face, and not so much on the possibilities of the opportunities we have. We are primarily framed to think about the burden of disease, not so much on the remedies, on the resources of remedies, on the problems in global health, and not so much on the exemplars in global health. Having witnessed the ravaging effects of the devastating earthquake and COVID in Nepal, and the revival after that, I clearly resonate with what Ernest Hemingway had written. A man can be destroyed, but not defeated. Despite the injustice and iniquity, the world is not short of good people, good intentions, and good institutions. But they don't directly come to us. We need to seek for them, reach out to them, and if not available, then create them. Resources follow ideas, not the other way around. Never let your dreams be stifled from a lack of resources. When with our mentors at UW, we launched one of the first cohort studies on cardiovascular diseases in Nepal, we had meager funding in our hand. Now my colleagues are conducting a 10-year follow-up of the study, and it has led to several transformational works in the country. So, I would like to conclude by saying that in coming years, as you start working in the field of public health, there will be times of despair, there will be times of disappointment, but take a moment to reflect and realize that this is the noblest of the profession. This job that you call a public health professional is a field in which you are dedicated to serve mankind, to alleviate the sufferings of others, and never, ever think yourself nothing less than somebody which I think should be called as the healers of humanity. Thank you.
Biraj, we are so honored by your presence and your speech today. We want to present you with a special gift and a stole of gratitude, which is an emblem of our appreciation representing this special day and displaying our university's seal.